Hello everybody, welcome to my presentation. My topic is cerebral aneurysm. Let's begin. What is it? What are the causes? Cerebral aneurysm, aka cranial cerebral aneurysms, brain aneurysms, is a blood-filled bulge forming at the branch of the artery. So the reason why it's at the branch of the arteries is because within the artery itself is very small, very thin, and the causes are still unknown to medical staff to this day. Okay, signs include a major headache, which is very prevalent, and it doesn't stop. The headache just keeps on going forever. Ruptured brain aneurysm. Symptoms include headaches, feeling sick, sudden confusion, and others. Symptoms of an ruptured brain aneurysm include headaches again, difficulty speaking, loss of balance, and others, as you could see here. Here we have classification, 3 types. The first type is most commonly occurs in adults, and it's the most common form of the 3. The first one, we have a saccular aneurysm, which is the picture you can see right here. The second one is fusiform aneurysm, and the third one occurs because an infection affects the arteries within the brain itself. All types are very dangerous, as you could imagine. Here we have classification by size. Small is less than 11 millimeters in diameter. Large is approximately 11 to 25 millimeters in diameter. And giant is greater than 25 millimeters in diameter. Very critical. Risk factors. Some risk factors include smoking, high blood pressure, drug abuse. It affects more adults than children, and it is more prevalent in women than men. High cholesterol, and more importantly, genetic connective tissue disorders. If you have any of these connective tissue disorders, your chance of getting a cerebral aneurysm greatly increases, and other risk factors as well. Here we have a very simple picture of overall just one example of the artery itself. And here typically aneurysms can occur inside the artery itself, or even at one of the branches of the arteries. Very dangerous. Here we have the most distinctive sites of where brain saccular aneurysms can occur. The red color is 30%. A very high chance of the brain aneurysm occurring there. White and yellow is less than 11%. Very low risk of the aneurysm occurring there. Here we have a CAT scan of an unruptured brain aneurysm. The red arrow is pointing to a white dot. That white dot is the unruptured brain aneurysm. Here we have the exterior picture of a patient that had recent surgery, emergency surgery of a cerebral aneurysm. Here you see the clear incision wound, a very large incision wound, as a matter of fact. This is near the frontal lobe. Very dangerous. Here we have 3 important preventions that will probably decrease your chance of getting a cerebral aneurysm. Very important to know. Here we have the circle of Willis. About approximately 85% of cerebral aneurysms occur within the circle of Willis. So right here in the picture, in the figure 1.9, these are all the major and minor arteries that are in the brain. Very important to know. Here we have treatment. Surgery. Microvascular clipping is one method of surgery. The second one is coil embolicization. Depending on how extensive the certain cerebral aneurysm is, the medical staff, the medical providers, the physicians, they will go up from there to evaluate which surgery will most likely save the patient's life. Local treatment centers in California of neurology. These are my references. This is a picture of my mom. So the main reason, the picture that I have here is because of my mom. She suffered a frontal cerebral aneurysm 7 years ago. She's still alive. I love her. She has no side effects. She's living her best life. Thank you very much. Bye.